Okay, it's my pleasure to introduce Daniel DeLap. He's a recent graduate of the University of Maine Aquatic Animal Health Lab. He successfully defended his master's research in May of this year, so congratulations on getting that done. He's been passionate about animal health since the third grade and is very excited to continue his passion in a dual degree DVM PhD program at the University of Illinois College of Veterinary Medicine. Looking forward to your talk and good luck in Illinois.
Perfect. Thank you so much. Well, hi everybody. As Dr. Phelps said, I'm Daniel DeLap and I'm with UMaine's Aquaculture Research Institute previously. And today I'm going to be talking about one of my graduate research projects testing the efficacy of a novel mucosal adjuvant using monocylated chitosan, MCA, against A. salmonicida subspecies salmonicida in Atlantic salmon. So with that being said, let's start off. So Aeromonas salmonicida, subspecies salmonicida, ASAL, is a well-studied bacterial pathogen in salmonid aquaculture, and it is the causative agent of furunculosis disease. It's a rod-shaped, non-motile bacterium, and due to its extensive research dating back to the 1800s, it was chosen as the bacterin or the antigen portion of our vaccine formulation. So vaccine formulations. Vaccine formulations can consist of two components, an antigen and an adjuvant. So an antigen can either be a whole inactivated bacterium or virus, and in our case that A. salmonicida bacterin, or a part of an inactivated pathogen. And depending on the type of antigen, this can result in either a weak or strong immunity. However, most commonly, it creates a weak immune response that provides low protection to the species, which comes to the second component. So the second component, an adjuvant, is a substance that enhances that specific immune response to the antigen and helps deliver that antigen to immune cells. But why do we vaccinate salmon? So Atlantic salmon are a heavily farmed species, and to decrease the risk of disease, they are commonly vaccinated, usually through injection like you and I. However, some of these adjuvants used for these modes of vaccine delivery can cause adverse reactions, such as stunted growth, injection site lesions, and tissue adhesion. Thus, research into vaccine adjuvant alternatives and different delivery methods is increasing and ever important to remain sustainable. So this leads me to the adjuvant used for this research, monocylated chitosan. Monocylated chitosan is generated by adding a mannose, a sugar group, to a chitosan group, which is usually derived from crustacean shells. This modification improves the biocompatibility and mucoadhesive properties of chitosan. Furthermore, the mannose groups are thought to enhance antigen uptake through antigen-presenting cells, as mannose receptors are commonly present on immune cells such as macrophages and dendritic cells, which are important for the endocytosis of various antigens. With this in mind, we set out to test a mucosal adjuvant, monocylated chitosan, referred to as MCA going forward, which could be used during an immersion vaccination delivery method in Atlantic salmon parr. Our first objective was to test the efficacy of MCA in Atlantic salmon against asalmonicida following an immersion vaccine delivery method through relative percent survival utilizing a cohabitational model. And just for brief explanation, a cohabitational model is a challenge model where a group of animals from various treatment groups are housed together. Following this, an infected individual is introduced to spread the disease, representing a more natural mode of infection. Which leads me to our second objective. Our second objective sought to determine specific IgM antibody production in the serum using Western blot analysis. This leads me to our hypotheses. So our first hypothesis was using MCA in combination with an Asalmonicida bacterin will increase protection and immunity when challenged with the pathogen in that cohabitational study. Additionally, we hypothesized that MCA or the MCA vaccination formulation would increase specific IgM antibody production associated with Asalmonicida when testing the serum. So this leads me to our treatment groups in our cohabitational model. So our trial consisted of 9 treatment groups and a sentinel group that was not included in any experimentation. We had a DPBS negative control group, a bacterin-only positive control group, and treatment groups of either MCA only or a vaccine formulation combining MCA and that asalmonicida bacterin at various concentrations. And additionally, due to the mucoadhesive properties of MCA, we added a nasal group that received a nasal vaccination of MCA plus that asalmonicida bacterin at a concentration of 1 to 10. Each treatment group was then elastomer tagged for easy identification and contained 60 fish per treatment group, which were equally distributed across 6 treatment tanks, resulting in about 90 fish per treatment tank. One of the biggest challenges to testing vaccine is to establish a proper dose for that cohabitational challenge model. So in our study, we conducted a lethal dose finding study. And in these study, varying concentrations of pathogens are introduced into individuals, and ideally a chosen dose would result in about 50% mortality. So for this research, 18 Atlantic salmon par were distributed across 3 treatment tanks, resulting in 6 fish per treatment tank. Selected doses of A salmonicida at 2.75 times 10 to the 3 times 10 to the 4 and times 10 to the 5 CFU per fish were injected into the salmon, and this resulted, unfortunately, in 100% mortality across all treatment tanks. With this in mind, we decided to use the 10 to the third CFU per fish, as it is the lowest dose tested. And although we aimed to establish a dose that would cause 50% mortality, we observed a higher mortality rate, indicating that our strain could be very pathogenic. So we can now move on to our in vivo vaccine efficacy study. So just to explain, below is a timeline that will be followed during this study. So to begin, Atlantic salmon par were brought to UMaine's Aquatic Animal Health Lab and acclimated for a 14-day period. During this time, fish were elastomer tagged with each treatment group and housed them in separate tanks. And following that 14-day acclimation period, fish were vaccinated, and each treatment group was vaccinated simultaneously with the corresponding vaccine formulation and evenly separated among those 6 treatment tanks and monitored for a 600-degree day period, which is a common practice in vaccine development, and this allows fish to mount an immune response. And just for reference, degree days are calculated by dividing 600 by the temperature at which the fish were housed, in our case 15 degrees Celsius, which amounted to about 40 days. After that 600-degree day period, a group of naive fish were injected with the select dose of asalmonicida at 10 to the third as determined from that lethal dose finding study. So 10% of the population of each treatment tank was introduced as shedder fish, and since each tank contained 90 fish in total, this led to the introduction of 9 shedder fish per treatment tank. So 4 days after the injection, the naive injected fish succumbed to the pathogen, with the treatment group succumbing between days 7 and 11. And much like this diagram is showing, that is exactly how this pathogen and challenge model occurred. So once the 60% of the DPBS negative control group succumbed to the pathogen, the challenge trial was ended and mortalities were sampled for external and internal gross pathology, and kidney swabs were taken to re-isolate that A salmonicida. So we can move on to our first result. So our first result was a Kaplan-Meier survival curve, and this was determined and compared to that DPBS negative control group. On the y-axis, you have the probability of survival, and on the x-axis, we have days, with day 0 at the start of the challenge. And as you can see, there are no significant differences between treatment groups as seen in that pink circle, as all survival probabilities are located within that pink circle. Using a Mantel-Cox log rank test, we had a p-value greater than 0.05. Furthermore, relative percent survival was calculated and compared to that DPBS negative control group, and this was determined by the formula 1 minus the vaccine treatment divided by the DPBS times 100 just to get that percent. And the calculated RPS values are negative in several treatment groups, most notably that nasal group at negative 25.6 and the MCA plus Bacterin at 1 to 10, and that is negative 10.3. With that being said, let's circle back to our objectives. So our first objective was to test the efficacy of MCA in Atlantic salmon against asalmonicida through relative percent survival. From this, there were no significant differences in survivability among treatment groups, which leads me to our second objective, to determine specific antibody production in the serum using Western blot analysis. And we wanted to do this just to observe if monocylated chitosan elicited any sort of immune response. So, following the cohabitational challenge, trial samples of serum were collected from baseline, vaccinated, and survivor fish. Serum was chosen to assess specific antibody IgM production because vaccination is known to enhance specific IgM levels in the serum. And as you can see in this picture, these are representative photos of the Western blot images that were taken, and the number of, above just indicate the lanes or the samples of each gel. So this leads us to our next result. And this specific graph is just showing the analysis of the band intensity relative to the positive IP injected control. And on the y-axis, we have that intensity relative to the control, and on the x-axis, we have the treatment groups. And using a Kreskel-Wallace statistical analysis, it was noted that there were no significant differences with a p-value of 0.6573. With this concluded, we can now return to our second objective of measuring specific antibody production in the serum. So, serum IgM levels indicated that there were no significant differences between treatment groups in specific antibody production of vaccinated baseline and survivor fish. With that being said, what are the key takeaways from this research? So, MCA in combination with an asalmonocida-bacterin did not elicit a protective immune response. And it should be noted that the bacterin-only group also did not elicit an immune response or provide protection. So, it is difficult to determine if MCA is the sole reason that we didn't see any protection in any treatment group. Furthermore, specific antibody IgM levels in the serum showed no significant differences between the treatment groups following that challenge portion. And I do want to note that the high dose of pathogen injected into the shedderfish during that cohabitational model could have affected how much protection was offered following vaccination due to that high overload of a pathogenic strain of Asalmonocida. And with that, I'd just like to acknowledge everybody that helped out with this research, specifically Dr. Sarah Turner, Dr. Sarah Barker, and Dr. Debbie Bouchard and Amber Johnston, who put in all their time, as well as Pacific Gene Tech, ARI, and the University of Maine Cooperative Extension. And with that, I'd like to answer any questions if anyone has any.
Thank you very much, Daniel. Great presentation. And the virtual applause begin. If anybody has questions, feel free to drop them into the chat or you can unmute yourself. Well, it's a
Hey,
Okay, I
Daniel,
lucked out today.
this
Oh
is
yeah, go
good.
ahead.
Go for it.
hey, it's been years past, but when we did ASAL challenge models, we used considerably less bugs in our injection. We were
Mm-hmm.
down to like 8 to 10 bugs per injection,
Mm-hmm.
and we would get our 40 to 60% mortality. Have you tried a lower dose of your challenge material?
Yeah, I would love to try a lower dose for sure. A lot of the literature that I read said about 10 to the third CFU per fish was what a lot of people injected. But I also read that fish can succumb to the disease with, like you said, 8 to 10 bugs per fish. And so ideally, if someone wants to take over this project now that I'm gone, I would definitely recommend lowering the dose substantially.
Yeah. Yeah, I forgot that you actually left, so sorry.
Yeah, yeah.
Great. Well, thanks a lot, Daniel. Really appreciate the presentation.
Yeah, of course. Thank you for giving me the opportunity.